Hi, in this video we are going to show you the importance of caring for diabetic feet and everything you need to know to avoid the most common complications. And we are also going to present footwear made exclusively for these conditions. What are diabetic feet? If you have diabetes, you may already know, but if you don't, I'm going to tell you what can happen to the feet of a diabetic person when their blood sugar levels are not well controlled. Due to nerve damage, sensory and motor deficits can occur, causing injuries often caused by ordinary shoes that can go unnoticed, resulting in sores or ulcers that can become infected. In addition, excess sugar in the blood can also cause a poor blood circulation, and this reduces the body's ability to heal these wounds and to fight infections in the feet. So, because of the lack of sensitivity and reduced healing capacity, foot sores can become infected easily, making them difficult to treat. In the most serious cases, they can lead to gangrene and subsequent amputation of the lower limbs. What treatment is like? Treatment for diabetic foot varies according to the severity of the condition and can include cleaning and disinfecting the wounds, use of antibiotics, use of appropriate dressings for the ulcers, and as a last resort, surgery. The importance of medical supervision. Patients with diabetes should have regular medical follow-up, including consultations with the endocrinologists and, when necessary, foot care specialists such as podiatrists. Early detection and proper treatment of a diabetic foot complications are crucial to prevent more serious problems and guaranteeing the patient's quality of life. Now that we know about the risks and consequences of diseased foot, let's talk about the most important thing. Prevention. We've already explained the possible problems caused in the life of a diabetic person, and now we need to talk about a very important point so that we stay well away from it. Prevention. Prevention is fundamental to avoiding serious complications from diabetic foot. So let's talk about the most important preventive measures. Firstly, take strict control of your diabetes. Keep your blood sugar levels within the range recommended by your doctor. Second, examine your feet daily to identify any lesions or changes and try to wear socks suitable for diabetic feet, which are made of cotton, seamless and with a clear bottom so that blood or secretions are easy to see. And third, ensure proper hygiene. Wash your feet every day with warm water and neutral soap, drying well between the toes. This prevents fungus and bacteria. Fourth, take care of your nails and skin. Cut your nails regularly and avoid removing corns or calluses on your own. And finally, wear proper footwear. Only footwear suitable for diabetics will protect your feet from injury and trauma. Well, with all this in mind, Nursing Care has developed a specific line of shoes to prevent all these problems and to guarantee mobility and quality of life for people with diabetes. And now I'm going to tell you the 5 reasons why Nursing Care shoes can take care of your feet properly. Prevent ulcers. Firstly, because they reduce pressure, our shoes have cushioning that provides even distribution of the person's weight to reduce high pressure points that can hurt the feet. Secondly, because they minimize friction, our shoes are padded, made of very soft materials and have no internal seams to minimize friction and prevent blisters and calluses. Protection against trauma. People with diabetes may not notice minor trauma to their feet due to neuropathy. We already know that. That's why Nursing Care shoes provide protection, because they are closed, sturdy shoes to protect the feet against sharp objects, impacts, and other external traumas. They also have a hard toe cap to protect the toes from outside strokes. Offer adequate support. Our shoes are well-fitting and supportive to help maintain the correct shape of the feet, preventing deformities. And they are anatomically correct. The shape is generous, so as to accommodate the feet and avoid pressure. It has width for the sole of the foot and width and height for the toes, which allows the foot to remain in the correct position. They offer moisture control. Why? Because excessive moisture can promote fungal and bacterial infections. So our shoes allow ventilation because they are made with breathable materials like natural leather and keep feet cool, and prevent moisture accumulation because they have absorbent insoles and materials that wick away moisture and help keep feet dry. They have an antibacterial and anti-odor effect. The entire line has a silver thread lining. The pure silver thread introduced into the lining fabric evenly covers the surface, making it soft, flexible and comfortable, and thanks to its permanent antibacterial effect, prevents the development of bacteria as well as the formation of toxins on the skin, thus reducing the possibility of infection. And that's not all. The permanent performance of silver ions keeps footwear odor-free and regulates the temperature when in contact with the skin. In summer, it has a cooling effect, and in winter, it has a thermal effect. They offer a personalized fit. Nursing care diabetic shoes offer specific adjustments to adapt to the particularities of each person's feet because they offer adaptability. They are shoes with an adjustable closure, allowing a firm and comfortable fit, avoiding the tourniquet effect on the foot. And the insoles are removable and molded to the anatomy of the feet, helping to distribute weight evenly and relieve pressure points. Conclusion: keeping your feet clean and dry, especially between the toes, nails well cut, and not going barefoot to avoid small wounds are simple but essential steps. And investing in suitable shoes for diabetic feet is a crucial part of daily care for people with diabetes. They help prevent wounds, protect against trauma, control moisture, provide a personalized fit, and, above all, avoid complications that can lead to serious health problems. Don't let this happen to you. Take care of yourself. Eat well, take the medication recommended by your doctor, move as much as you can, and take precautions. Shoes designed for these problems should be part of your care so that you can enjoy life as much as possible. Did you know that there is a right way to choose shoes for diabetic feet? And that there is also a right way to put them on? In this video, we will explain it to you. Pay attention. Once you've chosen the model, the first thing you have to do is remove the insole from the shoe and place it under your foot. Note that your entire foot must be within the confines of the insole, and your toes must have 1 centimeter of clearance from the edge of the insole. Once you've found the right size shoe, how should you put it on? If the patient puts on the diabetic shoe as they would any other shoe, the fit may be too loose and the foot can move inside the shoe, which can lead to injuries, especially to the toes. Look at this. I can even put my finger here in the heel. That can happen because when you walk, your foot moves forwards and starts to hit here. The result, we already know: injuries. So how do I avoid this? I put the shoe on, then once the shoe is on, I put my foot at 45 degrees with my heel against the heel counter, like this. This forces the heel to rest against the back of the shoe, and only then do you tighten the Velcro straps. It has to be tight, it can't be loose. In this way, you leave the instep area with the heel counter here firm. So what happens? You no longer have any movement between the instep and the heel. The toe stays here, so the toe is here and I have a margin here in front. The toe can no longer touch the shoe, and if it doesn't, there is no injury. And this is extremely important when fitting diabetic shoes. It's a very simple measure that we are sure will help prevent many problems. So, we have the shoe on. and tightened correctly. One last check is needed. We have to ensure that the shoe is neither too loose nor too tight on the front of the foot. How can we make it? We place both thumbs on the shoe in the area of the joints and pressing a little, bring the two fingers together. If the result is a small wrinkle, it means that the shoe is good for the foot. There is a light excess volume that is not harmful, and if the foot swells during the day, this extra will accommodate the swelling, ensuring that the shoe is not too tight. If the result is a large wrinkle, the shoe is too loose and could cause friction sores. In this case, we remove the insole from the shoe and place inside the half-cork insole that is delivered inside the box with the shoes. Finally, we reinsert the shoe insole and check again. If the result is no wrinkles, the shoe is too tight and could cause pressure sores. In this case, you must exchange for a larger size. These are very simple measures, but we are sure they will help to avoid many problems. Take care. See you next time.